Hey guys, welcome back to the Respiratory Therapy Resource Center. So today's video is on my oxygen desaturation algorithm for intubated patients. If you want a copy of the algorithm, all you have to do is click in the bottom right hand corner of your screen, subscribe to my channel, and then follow the link to my website and get your free copy of the algorithm. I hope you guys have a great day. Please enjoy the video. Hey everyone, welcome back. So this week's video is on the oxygen desaturation algorithm that I made, and if you subscribe to my YouTube channel, you can go to my website, respiratorytherapyrc.com, and use the promo code on my website to download your free copy of it. So let's move on with the oxygen desaturation algorithm. So this algorithm is based on patients who are intubated on the mechanical ventilator, and it's also going to be starting out assuming that the nurse is the first responder, because usually the nurse is the first responder, and then we'll go through as RT arrives and helps in the assessment of the patient. So bagging is always an option for patients, always bag at your discretion. However, in the time of COVID-19, remember to follow your hospital policies and guidelines. So you have a desaturating patient on a mechanical ventilator, right? So we're gonna go through steps 1, 2, 3, and 4. Step 1, check your waveform. Always make sure the pulse ox is in a good spot, a good location, and it's fully on the finger. And if not, then get a better waveform. Change out the pulse ox, put it on another extremity, and try that, okay? So once you have a good waveform and you know it's a true desaturation, then you go on to the next step. Step 2, suction your patient and raise the FiO2 to 100%. And this again is assuming that the nurse is the only person there. And let's say this doesn't work and your patient has continued desaturation, you continue on to the next step. Bag the patient if 100% FiO2 is not good enough to correct the saturations, right? And at the same time you're doing this, you're calling for help, or you're calling with your other hand for the respiratory therapist, right? Step 3, call respiratory, and both of you assess the patient and see what else is going on, right? So if you have corrected saturation at this point, great, you can stop. If not, continue on with desaturation in the green. So assessment, you and the respiratory therapist are going to go through your assessment together, right? So you're going to auscultate the patient. Do they need a breathing treatment, etc., etc.? Perhaps maybe a lung collapsed, etc., etc. Check the vital signs of the patient. How's the blood pressure? How's the heart rate? How's the respiratory rate? Check the mentation of the patient. Check the sedation levels of the patient. Do you have any other medications that you can give? Any PRNs available? Check the PIV. Make sure the PIV is not infiltrated, and that stands for peripheral IV, right? So moving on to the next step, you're going to do, based on your assessment, a therapeutic intervention, right? So now you guys have assessed and you're like, okay, I can give a PRN, or maybe the respiratory therapist is going to give a nebulizer treatment, etc., etc. Go through your therapeutic interventions together, see what you have available, and if that still doesn't work, you move on to step 4. Notify the physician team, call the physician, wake up a doctor, hey doctor, get over here. And then the doctor most likely is going to order other things, other diagnostic tests, labs, chest x-rays, other immediate things that we can gather more information about the patient as to why they're still desaturating, right? And most likely in that time, since you're bagging the patient, most likely their sats have already recovered. However, if their condition has not, and they are still having an acute change, then they're still gonna order diagnostic tests anyways. So let's say we continue on with desaturation. You're gonna perform another therapeutic intervention with the physician team, right? So the physician team is going to say, okay, well, now we need this, now we need that. They're going to order more things. They're going to do the diagnostic tests, get back more information. And then once they have that information, they're going to say, okay, now we need to add these. We're going to change the vent settings. We're going to add more nebulizer treatments. We're going to start IPV. We're going to change or titrate the sedation levels of the patient or add another medication, right? So another therapeutic intervention will take place. And now after all of that, you should have a corrected saturation and you can finally stop, okay? And you can finally take a deep breath in, do all your charting, okay? So congratulations, you saved the patient. the nurse, the RT, the physician team, everybody, right? So you all saved the patient. Congratulations. And I hope you got something out of this short video. And I really hope you take advantage of getting the free PDF, okay? Subscribe to my channel, download the PDF, use the promo code at my website. It will be in the description underneath this video. All right, thanks for watching. I appreciate y'all taking the time to watch this video. I hope you enjoyed it. I hope you learned something new. And if you don't mind taking a minute to subscribe to my YouTube channel, I would greatly appreciate it. Also, don't forget to check out respiratorytherapyrc.com. I have some ebooks available you guys might like. So check it out. Have a great day. Bye.